What should patients look for when choosing a doctor for endometriosis care? Do certifications matter?
The first thing I will do, like if I am a patient, I find out whether she is like fellowship trained. Now, I'm going to acknowledge that there are, like, I know many of my colleagues like who might not have gone through a fellowship, but they have been trained under like a really good surgeon who does endometriosis surgery. So they have done it with them. So though it is not like an accredited fellowship, but they have been trained by this person who I know is a good endometriosis surgeon. So I will trust them. Believe me, because of social media, patients are very, very smart now. So there are ways to find out. But also, and again, I should not say you should go by Google reviews, because I'm not going to say they're not always correct or incorrect. You should talk with people who I have done surgery on, or who that particular surgeon have done surgeries on. So I know it is difficult though. It is difficult. Like, I'm saying this because, I've been a physician. I know who does what, but it is very difficult for common people to figure that out. I mean, most people don't know also about endometriosis, like you said, like unless you're having pain and you're Googling and then you say, oh, I have this symptoms. So probably I have endometriosis. So many patients are actually coming to me and said, well, I asked Chat GPT, I have this, I have pain, I have bloating, I have pain during intercourse, I have, all these symptoms. And then Chat GPT said, I have endometriosis. So that's why, I'm here. Because so it is difficult to find that right person. But the main thing I will look for is whether that person is fellowship trained to do these kind of surgeries. Because in residency, which is like that 4 years of OB-GYN residency, you don't get enough training because you are doing, OB also, which is like the baby and the delivery. And then you don't have much time to do surgeries when you are in residency because it's very OB predominant, OB meaning like obstetrics predominant. And also in general practice, when you are doing obstetrics and gynecology, you're probably not able to, concentrate on one over the other. So obstetrics and gynecology are come two very separate situations. They are connected only because, you GYN and then you get pregnant, but it's a completely different situation. That's why we have these fellowship that people who want to do like, obstetrics, they do like, high risk pregnancy, maternal fetal medicine, or they do that general OB practice. And then we have the GYN who goes to like fellowships like, like I did.